guys, how's it going? Happy Friday. Welcome back to the Q&A. Today I'm going to be talking about a topic that I get many questions on. It is what to do about bags under the eyes and puffy under eyes. I did a prior Q&A a while back on dark circles under the eyes, so if that's you, make sure you check that one out. But today I'm going to be talking all about those puffy under eye circles that can occur sometimes when we haven't slept enough, what can be done about them, and that sort of thing. If you're new here, welcome. My name is Andrea. I am a dermatologist, and I have a YouTube channel here called A Day with Dr. Dray that I love sharing my life with you all on through my vlogs, as well as sharing some fun plant-based recipes and a lot of focused skincare content and skincare Q&As related to dermatology and conditions of the skin. So if that type of content is of interest to you, then stick around and subscribe for more. So with that, let's get started. Under eye bags, for the most part, are due to just kind of transient retention in fluid. Total body fluids are being retained, and it manifests under your eyes and other places as well, but I think sometimes it's most apparent under the eyes. And a variety of things can cause it. Most commonly, that type of swelling or edema is due to maybe a little bit too much salt in the diet, or a high salty meal. Sometimes eating out in a restaurant, you may notice the next morning that you have puffy under eye circles. That causes the body to hold on to water, and it manifests underneath the eyes with those under eye bags. One of the things that's supposed to happen while we're sleeping and getting restorative sleep at night is that part of our nervous system, the parasympathetic nervous system, kind of takes over so that the body can restore itself, and we stop going into that fight or flight, run away from the bear response. And when that occurs, the blood vessels that perfuse our skin kind of open up a little bit. This is so as to allow nutrients to diffuse into the skin so that the skin can heal itself while we sleep. This is why sleep is so important for our skin as an organ system. And bear in mind, though, that when those little blood vessels dilate, particularly if there's any extra salt going on, that's kind of going to be the mechanism that contributes to the under eye bags first thing in the morning. And when we haven't slept enough and allowed our skin to properly recuperate overnight, then that process is somewhat delayed. And that is why when we don't have a very good night's sleep, we wake up and we have bags under the eyes, sometimes a little bit more so than when we do get a good night's sleep. Besides salty foods and retaining salt, as well as poor sleep, another common trigger for swelling under the eyes or puffy under eye bags is just kind of chronic seasonal allergies and kind of sinus problems, what's called allergic rhinitis. If you're somebody who lives in an environment like Houston where there are a lot of plants that have pollens that get aerosolized, they land on our eyelashes and the thin skin around our eyelids and can cause just subtle irritation in the skin. You're rubbing your eyes, and that can contribute to bags under the eyes for sure. Not only that, the cosmetics that we apply around the eyes can also contribute. Eye creams, for example, I get questions. I notice you don't use an eye cream. Yeah, that's why. I don't want, worsening under eye bags. Most eye creams, or most things marketed as eye creams, have tons of fragrancy ingredients, botanic extracts that look an awful lot like pollen in them, and that actually can, cause those blood vessels to open up to try and flush out the toxin that you just put in. I know that's a popular concept. To try and flush that out off of your skin, those blood vessels dilate a little bit, and you can get puffy under eye circles, okay, as a response. Puffy bags under the eyes. And likewise, things that we don't realize that we're touching, that are coming in contact with our face, whether it be stuff that's on our hands and we inadvertently touch our eyes. We're touching our face all of the time. It's really difficult not to, okay? So things that commonly get transferred to the eyes from the hands, If you're using some kind of scented hand lotion, a fragrancy cream, it can be irritating around the eyes and you may not even be aware of it. If you are somebody who wears nail polish, acrylic nails, shellacs on the nails, those things can all get transferred to the thin skin around the eyes, and your immune system and body are like, ew, get that off. The skin around the eyes is very, very thin and delicate, okay? So the immune system and the blood vessels, they are right there on high alert, okay, for everything that you put on. So as I say, I always, kind of emphasize just minimizing the stuff that you put on your face, and, the moisturizer that you use on your face should be fragrance-free and gentle, and it should be such that if you're putting it on your face, it should be able to go around the eyes with no problem. And you don't need an eye cream. You're getting your moisturizer under the eyes to prevent dry eyes, so there's no need to be going and grabbing for some jazzy eye cream that is actually going to exacerbate this problem. All right? Likewise with sunscreen, you need to put sunscreen around the eyes to protect the eyes. Skin cancers on the eyes, eyelids are incredibly common. You need sun protection there. Sunglasses can help quite a bit, but they're not, unless you've got the kind that, the glaucoma glasses that you get after you've had your eyes dilated, which most people don't rock all day, understandably so. You don't get the full gamut of protection. You still need a little bit of sunscreen in there to kind of help things along. And sometimes sunscreen can be pretty irritating. Chemical sunscreens in particular tend to sting people around the eyes. So selecting a fragrance-free sunscreen that is zinc or titanium dioxide based can sometimes be a little bit more easy to tolerate. Or I find that personally that the combination zinc octinoxate sunscreens like the Ulta MD UV Sport, I have no problem slapping that around my eyes. But some people are more sensitive to it than others, understandably so. But do protect your eyes and try and find a sunscreen that doesn't sting. It can be challenging for sure. But aside from poor sleep, retaining salt, and stuff that you're putting on your face, stuff that is inadvertently coming in contact, allergies, one of the other things that you should kind of try and understand is that there are some other medical conditions that can cause the eyes to be kind of extruded and overall appear puffy and kind of sticking out. That's a condition called exophthalmos, okay? And it can kind of exacerbate the appearance of undereye bags. That is a condition that occurs with certain thyroid diseases. So, if it's always prudent to start with your primary care provider to make sure that everything is okay, rather than just assuming that this is something that you have been gifted with. Make sure that there's not an underlying medical cause, whether that be the thyroid, an exophthalmos, or perhaps you have a little seasonal allergy, and an antihistamine can help make those allergens a little less of a nuisance for your immune system and subsequently then help the under eye swelling. So always check in with your primary care provider. Make sure there's not an underlying medical thing contributing to the under eye bags. But how can you prevent under eye bags outside of making sure there's not a medical cause? You obviously can avoid salty food. And make sure that you're drinking enough water if you do have a salty meal. But you don't have to go overboard with the water consumption. Everybody wants to know, well, how much water should we be consuming? Should we be doing the 30-gallon challenge? No, you don't need to do that. If you eat a salad a day and a glass of water here and there, that's probably enough water, honestly. You can actually die from drinking too much water, so don't go berserk on the water consumption. But aside from limiting the salt in your diet, the other thing that can help a lot, but it's difficult to do, we all love to sleep. We all have our sleeping positions. If you are a side sleeper, a stomach sleeper, well, under eye bags are probably more problematic for you than back sleepers. Training yourself to sleep on your back can help quite a bit. I say this from personal experience. I trained myself to sleep on my back after being a stomach sleeper for many, many years. I noticed personally a substantial improvement in just dark discoloration and under eye kind of sagginess, as well as the health and growth of my eyelashes, because I was no longer smushing my face all night up against that pillow. So I think that can help tremendously. I've seen that help other people as well. Elevating the head of the bed when you do sleep on your back, meaning putting a few pillows underneath your head so that your head is at an angle and the fluids can drain back to your heart. That can also help a little bit as well, okay? Everyone always wants to know about the benefits of facial massage, and if I can talk about that. You know, sometimes, for just all intents and purposes, you know, taking a cool cloth and putting it there and just lightly pressing it can help. But, you know, all of these facial massage type things, don't put too much stock in that. You know, whether or not they help, it's hard to say. The lymphatic system, guys, I mean, it's going to drain on its own. Having somebody massage your face, it's really not indicated, okay? The only time massage for swelling is really done in the medical setting is on the lower legs in a medical condition called lymphedema. Normal aging of the face and, you know, cumulative age-related changes in the face, they don't warrant lymphedema therapy, lymphedema massage, okay? And there's no reason to suspect that your lymphatics are not draining the fluid properly. You know, it's really just a matter of the fact that when we sleep, the under eye bags are more noticeable because our body is trying to bring nutrients to the surface of the skin, and that's kind of why they are a little bit more prevalent there, particularly after we haven't given our body enough time to sleep at night. So facial massage is something that, you know, I mean, if you enjoy it, it sounds relaxing, actually. And, you know, relaxing, maybe you had a hard time falling asleep that night, and if you get a facial massage, maybe it improves sleep, and then the bags get better, too. I guess I can see the argument there, but, you know, there's not like a double-blinded, placebo, randomized control trial looking at facial massage versus not in an under eye bag volume, okay? So I can't give you a true objective answer, but, you know, theoretically, I suppose a little bit of gentle massaging makes some sense, but, you know, don't put all your eggs in one basket at the risk of sounding cliche. When you go to the spa and they put those cucumber slices around your eyes, does that really do anything? You know, cucumber does have some anti-inflammatory biomolecules, but it's unlikely that that's really what helps. What more than likely is the reason why putting cucumber slices on your eyes kind of helps puffy eyes and makes them look a little bit brighter and more rejuvenated. It's simply the fact that they're cold and cool temperatures can cause the blood vessels in our skin to clamp down. And, you know, since the sags and bags under our eyes are the result of fluid that's accumulated there as the blood vessels relax a little bit, it makes sense that putting the cooling eye patches, the cooling cucumber slices can help, okay? So cucumber is pretty gentle and, you know, kind of a benign thing that you could do. But, you know, again, don't expect like a remarkable transformation. Sometimes it can help, and it's really relaxing, okay? So, you know, all these things, the benefits of relaxing are tremendous on skin and overall health. So I'm not discrediting that, particularly if you're somebody who's not sleeping and your bags are getting worse. Yeah, I mean, chill out, massage your face, put some cucumbers on there, do whatever you have to do to relax and go to sleep. That will help. But, you know, overall, I don't think you need to lose sleep over finding the right cucumber slice, okay? So, you know, there are a variety of home remedies that are popular for under eye bags, and I don't think any of them are worth pursuing, in all honesty. You know, there's some touting and jazzed excitement for putting caffeine-containing creams under your eyes, and really this doesn't make a lot of sense. I mean, caffeine, yes, is a vasoconstrictor, can constrict the blood vessels, but the likelihood of it getting around the blood vessels and you know, altering them, it seems very unusual, but perhaps it could work. Again, we don't have much data on that. And if anything, the ingredients in caffeine-containing creams are more likely to be the kinds of things that your blood vessels and your immune system go, oh my God, we've got to dilate and focus on getting this crap off. So I would say go for the cold cucumber or a little bit of gentle tapping, you know, a little bit of gentle massage there, rather than some caffeine-containing cream. Or another popular one that I've heard, you know, since I was young is putting Preparation H under your eyes. Preparation H is basically just a a petrolatum-based ointment, kind of like Vaseline, but it has an ingredient in it called phenylephrine. And the safety of that around the eyes isn't really well established as far as putting it on the skin around our eyes. It is a vasoconstrictive drug, a vasoconstrictor, phenylephrine. And, you know, whenever you put these things on the face, you run the risk that the blood vessels, once the medication goes away, the blood vessels will dilate as a rebound effect. So I would caution you against that preparation H remedy that's popular. And instead elect the cold cucumber slice thing, which is a little bit more conservative and probably less likely to cause you problems. So puffy eyes are usually temporary and they don't require any sort of medical intervention. Most people can, you know, get them to go away with the cucumber slice thing and, you know, avoiding salt. But if they're persistent and you've seen your primary care provider and like a thyroid disease, exophthalmos, has been ruled out, is there anything that a dermatologist can do or it would be worthwhile to see a dermatologist for? There are two conditions. One is periorbital a little fat herniation, as well as another condition called malar festooning that are kind of anatomic, subtle abnormalities that can be evaluated and subsequently treated by a dermatologist. What are fat herniations? Well, we all have fat around our eyes, kind of underneath our eyes. That's what kind of supports the eye. It's called periocular, you know, fat pads, periorbital fat. As part of normal age-related changes, we lose some of that fat, and that is what is responsible for some of the hollowness that appears in our eyes as we get wiser. And sometimes those little fat pads can you know, at times migrate and herniate out into the little spaces under the eyes, the skin kind of compartment under the eyes, and cause a persistent bag there that's not actually fluid, it's just a little fat herniation, okay? So that is something that could be determined by, you know, a dermatologist or even a ophthalmologist, I believe, as well. And then a malar festoon is a semicircular swelling under the eyes. It's kind of a persistent fixed puffiness, and that is related to a local kind of abnormality in the drainage of the fluid, and you know, no amount of massage or cool compresses can really help that to go away. Okay, so that's kind of another anatomic abnormality, while not life-threatening, that can be evaluated by a dermatologist and intervened on with some cosmetic interventions. And by cosmetic interventions specifically, I mean some types of filler can be injected around the eyes. Okay, so if you are really, really bothered by it and you want cosmetic treatment for them, a dermatologist or ophthalmologist who specializes in cosmetic procedures would be the physician to see. And then there are certain types of under eye bags that are kind of, you may have had your entire life. It's like a little jelly roll under your eye. It's not really a bag under the eye per se, but just right here on the eyelid, it's a little roll of extra skin that it bothers people cosmetically, and that can also be treated with a cosmetic procedure, Botox. Botox injections can help diminish the appearance of that. And again, that is something that you would want to seek out a board-certified dermatologist with lots of experience injecting Botox in that area, as well as you could also see a ophthalmologist with lots of experience injecting Botox around the eyes. Yeah, I mean, the way that we look and the appearance of our eyes, it can really honestly influence how we feel about ourselves, our confidence, self-esteem. Don't be shy about speaking up about, you know, seeing somebody who does these type of procedures. If you are, you know, really bothered by them, the way that we feel and our self-esteem is paramount to our function in day-to-day living, our success in life, our overall happiness, and ultimately longevity. So it's not anything to be ashamed about, and it's definitely something to speak up when you've thought about it and think that it's something that you might want to pursue. No one's going to judge you, and you know, there are many dermatologists who exclusively do these cosmetic procedures. It brings them a lot of joy to talk about them with patients who who want to change these things. They love doing them. They love helping people to feel their best selves. So don't be ashamed. Don't feel shy about it. Likewise, there are many ophthalmologists out there who likewise love doing this because they like to make people happy. I mean, that's one of the things. We like to make people better in medicine, and recognizing that the way we appear it has such an impact on our self-esteem. This is something that we take very seriously, and you should not be ashamed about and speak up. Overall, that is all I really have to say about bags under the eyes, though. So I hope this video was helpful for you guys. And if you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye.